are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health. This is Bianca, your host. It's another great day to celebrate our health and wellness, and today is no exception. I'm really excited about today's show because we're going to be talking and continuing to talk about our bone health and joint health. In this past couple of weeks, we've talked to a few guests when it came to our professionals and individuals who've suffered through some of these discrepancies when it comes to the way that they've lived their life, or just genetics, or just, bad nutrition, things like that. I'm looking forward to today's guest as well because, this guest is like my last guest that we had from last week is a orthopedic surgeon, and she's been around for a very long time, over 26 years. But not only that, she's been a part of a lot of the Hawaii Medical Association. She was the former president of the Hawaii Medical Association, former president of the Hawaii Orthopedic Association, former president of Western Orthopedic Association. I mean, my God, she's really not only has her practice, but she's really put out there in the community and really became a part of the community of orthopedic doctors. She's also been the board of counselor representative for the Hawaii for American Academy of Orthopedic Surgeons. And she's been here in Kailua working with her group, the Windward Orthopedic Group. And she's been working on not only adults, but she's also worked with kids at Shriners Hospital and helped with knee and hip replacements. We're talking about with none other than Dr. Linda Rasmussen. Dr. Linda Rasmussen, are you in? Sorry, I'm like stuttering for a second because I'm so excited to talk to you. I'm just like overwhelmed.
No, I'm here.
I'm thinking about all the things that you've done. It's just, I'm a little blown away, actually, to be honest with you, that you've been a part of so many different organizations. I believe your intention is to really try to get people to understand and really appreciate what you guys do as orthopedic surgeons. It's really not that light when people think of, I'm just going to get a joint replacement. It really is extensive information that you want to share. And I know you to be someone who wants to educate, not only help your clients, but you want to educate your clients.
Very true.
Well, welcome to my show, and I appreciate you because I know you're very busy. So
that's fine. No, thanks for having me.
No, absolutely. And I wanted to kind of talk to you a little bit about what you're doing because I know you've been here for a while, and I know you're well-rounded. Give us a little bit of an idea about your practice that you're currently in, and then we'll backtrack of some of the things you've done in the past, and then we'll get into other things when it comes to, orthopedic stuff with our joints.
Sounds good. I've been with the Windward Orthopedic Group in Kailua for 26 years, and I also work at Shriners, and I've volunteered there for 26 years. And my primary focus is hips and knees, and I try to treat everyone conservatively, but sometimes people require surgery, and my specialty is hip and knee replacement, and I also help out with the Kalaheo football team and so do some sports medicine, but try to help out where I can.
It's really about prevention with your practice, from what I understand. You're really trying to educate people from really losing their ability to have full range of motion with their knees and their hips.
Very true. My successes are those that I can sometimes tweak a lifestyle change or a change in activity or a new exercise that allows them to do the things they want to do and maintain their independence, especially as they become older.
So what is the difference between an orthopedics versus sports medicine? And obviously we have neurosurgeons, but you have a specialty. So give us a brief description of what orthopedic doctors are and what your guys really focus on.
Your orthopedic surgeons have normally an additional 3+ years of education on someone that just did sports medicine. We're trained in surgery, so we still treat people conservatively. We're frontline for orthopedic care, but yet when you fail the conservative treatment, we're the ones that can do the surgical aspect if that is necessary. So we're kind of the end of the line. there are people that are trained more with just sports medicine. They don't do surgery, so they are they'll do injections, and they can treat, diagnose, order for their tests, and then we'll pass them on to an orthopedic surgeon if need be. Our practice, we really focus on taking the patient from the beginning injury all the way through if they require more extensive surgical treatment. So it's kind of more you go from one point to the other point. So I think, we overlap a lot on the conservative part of the, a sports medicine doctor, but they wouldn't do like an ACL reconstruction.
Right.
Like I had a lady yesterday who had a severe skiing injury. She needs an ACL reconstruction. She needs, meniscus. So that person's going to need someone in our area of specialty.
Yeah, so basically, does the sports medicine doctor versus an orthopedic, the rehab factor would be more on the sports medicine side, wouldn't it?
Well, no, I think we do the same rehab, and, we all have our favorite physical therapists that we refer to. Mine are very much part of the team, so I am a little particular with who I refer my patients to for therapy, but I don't think the care is really very different. You do have some orthopedic surgeons like at Straub, they're going to have people that are non-operative that do the care so that they just get the surgeries. But in our practice, we tend to take the people that don't require surgery as well as the ones that do require surgery. So it's a little different, especially at Kaiser too. To get in to see the surgeons, you got to see, the primary care, and then you may see a physiatrist or a pain management or a sports medicine specialist, and then you get in to see the orthopedic surgeons. But in private practice, we really take care of people from ankle sprains to people with traumatic ankle injuries.
So your specialty being the knee and the hip, it's really interesting. And I'm surprised that you're not also focusing on the ankle, because I know as a personal trainer, we know that a lot of the knee injuries is because of maybe either the ankle issue or it's a hip issue, which is causing extra pressure on the knee to balance the body in keeping it lined up properly. I know that sometimes when you have dorsiflexion issues, when you can't properly have a proper walk, or we call it gait, a lot of times the knee issues pop up because there's something going on either with the ankle or it's going on with the hip. So what is your diagnosis? And I'm not a doctor, so I'm asking you as a doctor, how do you guys differentiate where the issue may be coming from if it's not structural for those patients that come see you thinking that they need surgery?
So I check everyone. Sometimes you can have knee pain that's actually being referred from your hip. Mm-hmm. And so people will walk in, I watch them walk in, and it says knee pain on their sign-in sheet, and I'm like, that's a hip. And and they don't have any hip pain. So everyone gets a pretty thorough exam, looking at, and I used to do a lot of ankle, but I have a partner, Dr. Brandy Black, who specializes in more the sports medicine ankle.
Nice.
So, if I get someone that, it's nice to be specialized, because then you are very thorough and very knowledgeable in that area, and it's something you're passionate about.
Right.
So if I have someone that comes in for knee pain, but their problem is primarily ankle, I treat them to a certain point, but if they're going to require ankle reconstruction, then they're going to go see, my partner, right. and I have another partner who does shoulder and hand,
nice.
Who's phenomenal. So, you always are, you try to treat the whole patient, but if they have something, that's basic, you bet I see them. But if they're going to require surgery, if it's an area that I don't do a lot of, I'll normally send them to someone that's what they're passionate about, that's what they know. And just like ACL reconstructions, I used to do those, but I wasn't doing a lot. And I have a partner that just loves those and does that. That's kind of her deal. And so it's much better. The patient, they're going to get better
care,
surgical care with someone that does that all the time, has done an extra year of education in that area.
So how can a layman or someone who's an athlete do a self-test to see whether or not they're really tweaked their knee or it's an ankle thing or if they're hip thing? Is there something that you guys teach your clients to kind of test at home just to kind of give them an idea if they need to see a doctor?
That's a good question. I think, if the knee really swells up, you got to look for the source of swelling. If it really swells up, certainly if there's bruising often indicates fracture. If it swells up, if you can't put weight on it, you really need to be seen. And it doesn't mean you have to go to the emergency room at 10 o'clock at night.
Right.
You can wait and come into like our office the following day. We have x-ray right in the office. Boom, 5 minutes, you have your x-ray, you have your exam, and you can look at the x-rays on the computer. And after a thorough exam and a history, you really have an idea of where you need to go. Sometimes the knee's so swollen, I can't tell whether there's a meniscus or an ACL injury. But, we have them come back the next week, and you can then you have a second exam on the same patient. And I got to say, oftentimes I can pretty much make the diagnosis before we get the MRI. Or you can say, this is, I think you bruised the bone. I wouldn't recommend an MRI. And so other times you can, you need an MRI right away. There's something major going on. But it's nice to have, you don't have to go to your primary care and then go to another person and then go to another person.
Right.
You can just come in, get everything done and in a very limited time. And you're seeing someone with those years of experience that's trained well. Sometimes you end up with a physician's assistant, and nothing against physician assistants, but, and then they have to go talk to the orthopedic surgeon.
They don't make the final decision.
Right.
Well,
So
I was wondering
nice.
too, though, how about the muscles that if someone doesn't take care of this, like let's say they injured themselves and they're just babying it at home. They're like, I have a swelling. I'm putting ice on it. I'm taking my anti-inflammatories. And then through a period of time, because people don't realize how bad chronic situations become, the muscular system then becomes weaker to support the joints. So how can we tell whether or not we've really done some damage? Once the swelling is gone, you can actually put weight on the joint, but there's got to be some kind of other signs neurologically or other things that you may have experienced through your patients, not coming to you soon enough.
Yeah, I think instability, like a meniscus tear, those are sneaky because your knee can buckle or give way, but then it'll feel fine at times. So you have days where you're not having any symptoms, and then you step off a curve and it buckles and you can fall. So I think, having a good exam is really important. It's even if I injure my own knee, I can't examine my own knee and determine what's going on. So if it doesn't feel right, I think the big things are stability, range of motion, and, locking, not being able to fully extend it, and then, persistent pain. And the big thing is swelling. If it really swells, there's normally something major going on, and you need to have someone look at it. And you're absolutely right. Delayed diagnoses lead to time off work, muscle wasting, and a lot of other issues that can lead to, other problems. So and I see many people where they don't get a diagnosis up front, and then, they've been to therapy for 3 months and they've been doing this and that. And it's like, okay, those aren't going to help a meniscus tear, for example.
Right. No, and I think for women, especially the way that our hips are designed and the way it comes in more of an angle internally where the patella bone is situated, I always, as a personal trainer, I always tell my clients that may have weak vastus medialis muscles, which is these inner muscles of the quad, which is your front leg muscles. I always tell them, please don't squat heavy. Please don't do heavy squats, because squatting is not the best for your knees, especially when you don't have strong muscles to support the knee, the joint itself. So you're absolutely right. The number one thing I see is women with patellofemoral joint problems, and they're out doing hula
or,
Yeah.
competitive hula, deep squatting. And it's like, no, you're putting 4 times your body weight on the back of the kneecap, and it doesn't ride as well in that group because ligaments are a little looser to have babies. And if those, and then they're working out, their lateral and central quads are very strong, and the medial quads, the inner muscles, they exactly aren't strong enough. And all the exercises are kind of geared towards men. And
Yeah.
you really need to work on those medial quads. So I'm a big proponent of strengthening the medial quads. And I tell people that's how you're going to stay out of my office.
Right.
Really straighten that leg out, rotate that foot out like a duck, and lift and work those medial quads.
Right.
And that makes a huge difference.
Yeah, the adductor muscles are needed as well, just to support. People don't really underestimate the power of their own body weight too. You don't need to really load your body in your joints just to get the muscle activation going too, just to get that muscle strong enough to support the joint. Because that's basically what our muscles do. It supports our joint system and keeps us moving. So, so my question too is, since we're talking a little bit about the muscular, how does arthritis affect the joint in people? Like what's happening with that?
Very good question. So the most common form of arthritis is osteoarthritis. It's very different than osteoporosis, which is thin bone. And in the joint, you have like coconut meat inside of a coconut shell covering the bone. And in younger people, it's very firm, hard coconut, meat. And as you get older, it's a little more soft, like a young coconut would have. And with time, you can get fissures in it or crevasses, or, and then the coconut meat can wear away. There's no nerve endings really in the coconut meat, but that underlying shell or bone has lots of nerve endings. So once you lose your coconut meat and you're bone on bone, that's what hurts, and that causes swelling and pain, and the lining of the joint, the synovium, gets very inflamed,
right?
And that pinches and can cause a lot of pain. And then your body, in response to that, forms spurs, extra bone to limit your motion, so that it doesn't hurt as much. So that's why your knee doesn't bend all the way back or go all the way up, or your hip can't get your shoes on anymore because your hip motion is less. That's normally due to spurs locking in the joint so it doesn't move as much, so it won't be as painful.
So how can we, let's say, recreate the synovial pocket or the fluid in that area? Can we get that back once we lose it?
No, once the coconut meat is gone, once your articular cartilage is gone, it's gone. Everyone's like, oh, you can do chondroitin, you can do stem cells, but you can't get new cells to form on an area that's like concrete and have them grow and form new coconut meat. It's just not.
So you have to replace it.
It's not possible. Yeah, there's a procedure where you can do your own cartilage cells if you have just like a little crater, and you can send those off and grow them, and then you put a little flap of tissue on it and inject it under. And that, I've done those before, but it's very specific. It'd be like you took a knife and popped out a piece of coconut meat and you had an area and you were real young. That you can do something with. But other than that, everyone's like, you can't do anything. So what you want to do is decrease the inflammation. Cortisone injections can help with that. Anti-inflammatories can help with that. There's Voltaren gel now that you can put on the knee. Turmeric is a very powerful anti-inflammatory. And, just keeping the joint moving is very helpful, and strengthening the muscles around the joint can relieve the stress on it. And changing your activities, sometimes losing weight. If you put on weight, especially with COVID, everyone's put on the COVID. It was the COVID-15, and now it's becoming the COVID-20.
Yeah.
And in some cases, the COVID-30.
Yeah, crazy.
The knees don't like that.
No, especially when you're sanitary too. You're sitting in that one position. Your hips don't contribute to the well-being of your knee either when you're in a seated position. So you really need to move, at least if you're sitting, move your leg up and down. So like doing a leg extension to get some circulation in that area too, to get the nutrients in that area. Little things like that. But I mean, I think it's interesting to me because I know that, medicine always is evolving and changing. And I know that surgery has become, a little bit more advanced with technical stuff like robot, machines to help aid with surgery and things like that. And you don't have to cut somebody open really for knee surgery. You can do, more of a higher tech type surgery, which downtime is less. So is there anything out there now that would be able to replace, let's say a meniscus or a disc of sort, or, how you do the joint, the hip joint? Is there a technology out there that we don't know about yet that you're doing, which keeps the patient healthy?
There's, like meniscus transplants, they haven't fared very well. It's pretty extensive on the recovery. You're looking at like 3 months of not putting any weight on it, and the success rate's not that great. So, but we're working on it. It's, it's a work in progress, but, no, I don't think I think, the total joints that we have now are awesome, and, the longevity is excellent. It used to be, the last 10, 15 years. Now, 90+% are still in at 20 years. I have patients that are 26 years with still the, a well-functioning joint, total joint. So the longevity is substantially better. And, we try, if you still have cartilage or coconut meat left, we avoid the surgery and treat things conservatively.
Right.
But when you get to the point where you don't want to get up to go get the paper or to change the TV or to, because the knee hurts so much, that's not good for your overall health. So, yeah.
So, Doc, hold on one second. We're going to do a really, really quick, 15-second commercial break. When we come back, I kind of want to talk a little bit about preventative techniques and maybe nutrition, things that we can kind of talk about that might be able to help people avoid coming to see you. But, they have to see you, they see you, but we try to help them stay healthy. So hold on, don't go anywhere, okay? All right, we'll be right back, guys.
You don't need to be a member of a gym to get your health and fitness back on track. Be Fit for You with a Be Fit for Health online personal training and nutrition program. With 30 years of personal training experience, Bianca will help you better yourself and be fit for health. For more information or to schedule a free wellness consultation, visit BeFit4Health.com for more.
And we're back. That was quick. I promised you guys. We're back with Dr. Linda Rasmussen, and she is an orthopedic surgeon at the Windward Orthopedic Group here in Hawaii, Kailua specifically. And she's been practicing for over 26 years. So, she's someone who's well versed in the hip and knee replacement and surgical procedures. So definitely by the end of the show, I'll give you guys an opportunity to find out how to get in touch with her. But we're talking really about what's really happening when it comes to orthopedic surgery and, things like that. But I really was hoping to hear there was, because, nobody wants to have surgery, right? I mean, and they definitely want to have the least amount of downtime as possible. And I know we've gotten really good at things like that. And, unfortunately, you were just saying that there isn't really anything like, miracle.
Yep.
I'm asking too much, right? Out there yet. But, who knows? I mean, it's incredibly true that you're saying that, if there's nothing there as far as a disc, you can't make that up unless you, grow it in the petri dish, so to speak, from your own, cartilage. But let's talk about preventative then. So if we want to avoid this, and I know you have a family, I'm sure you've talked to your kids about the way that they do things. What would be some of the advice that you would give our folks out here listening to the show today, to keep their knees healthy, their hips healthy, and what would you suggest as far as nutritional plan to avoid and to help them keep their joints lubricated?
So number one is I really think turmeric's a wonderful thing, and it prevents cancer, and it definitely is a better anti-inflammatory in some studies than your Motrin, naproxen, Aleve, ibuprofen. So that's a nice thing. I think everyone should just take one turmeric a day. You can get the pills at Costco and just take a pill. You can do your own route if you want to, but that's a good thing. The other thing is staying away from the sugars and the gluten. Gluten is called gluten because it's short for glue.
Right.
It really plays havoc with your joints. So I find a lot of people, you just get them away from the breads and the cereals and the pasta, and they're like, wow, my joints feel so much better.
Right.
So that's real key. A lot of people that do more of a keto type diet, they're like, wow, I feel so much better. My joints feel better. My back feels better. So I think it's very important. And, if you can just change some of your bad habits, have an egg for breakfast or have, something that's more with protein or a protein shake rather than, the pancakes or waffles. And then, if you get a plate lunch, stay away from the rice and definitely max salad.
Yeah, I know.
Oh my
I was
gosh,
gonna
it's
say.
like a heart attack waiting to happen.
I know. So good, but yeah.
Those things really affect your joints, and they affect, your overall health, your mental health as well. So, trying to stay more of a low carb and definitely the simple sugars and the processed foods and sodas. Just stay away from all that. You can have like a bubbly seltzer water, but
Right.
stay away from the sodas. It doesn't matter if they're diet or regular. They're really not good for you. And I think for people, don't focus on the scale. Really focus on being healthy. And if you do that, the scale will kind of drop. But you got to focus. The scale's an emotional roller coaster. Just focus on being healthy and eat, good, helpful food. There's a show on Netflix called Fed Up that really explains what you eat, how it affects the viscosity or the thickness of that joint fluid. So with arthritis, it's like trying to start your car with no oil around the pistons. It's like someone put water in your oil, that fluid doesn't stay adherent to the joint. And so when you go and get up, there's nothing lubricating it, and
Right.
it causes damage to the joint. So you want to a good diet is critical, especially if you have a family history of arthritis, very important. And even with gout's very prevalent in our local population. That everyone thinks, oh, it's the red meat. No, it is the sugars. Very good study out of Mayo Clinic showing the sugars and the carbohydrates are really big contributors to the gout.
And how do we treat gout today? Is this still cherry juice as far as homeopathic and what's the apple cider vinegar? Some of the things that was out there for people who don't have access to a doctor usually.
Yeah, I stay away from the sugars and the carbs, and I'll tell you, you won't have to deal with the gout attack.
And beer, because that's also carbs.
Yeah, treatment with gout, you're kind of chasing your tail with it, but a lot, the anti-inflammatories. I mean, if you get a real bad attack, especially in your knee, best thing is to get a cortisone injection, because the gout, they're like little shards of glass.
Oh,
the crystals are, and the cortisone will dissolve those. So that's very important. And you know what? If you go to the emergency room, most places you can't get a cortisone injection in the emergency room. Yeah, so coming in to see an orthopedic surgeon is kind of key. Or if you have a good, like a sports medicine person that does injections, and some primary care doctors do injections as well. But that's very key.
That's crazy. Why wouldn't they offer that? Is it too alternative?
Yeah, there's a number of different reasons, but I think mostly the ER doctors just they have to know everything about everything.
Right.
And it's just crazy the amount of knowledge they have to have and all the variety of things they deal with. And putting cortisone in a joint is just not a normal thing that they have in their wheelhouse as far as, not part of their kuleana.
Well, what other options could you do then? What other things could you put in if cortisone isn't an option? Epidural?
Oh,
No.
there's nothing. Cortisone's the only thing that really works with the gout.
Okay.
So normally if they have a gout flare, they'll call and say, we'll get in to see your orthopedic surgeon the next day, and they call and we get them right in.
Well, that's crazy. Well, I know that gout is prevalent here in Hawaii. I've seen a lot of. I used to work for a supplement company a while ago, and I used to have a lot of guys come in. They're construction workers, and they'd be like, "I got gout. I need something for it." And the only thing that I could say is either fish oil, apple cider vinegar pills, or cherry pills or whatever you call it, just to kind of get that down. But I would have to talk to them about diet. It really does come down to your nutritional component, doesn't it?
Yes, it is important.
Everything.
In everything.
Yeah.
It really is. Yep.
I mean, people don't realize this. I mean, some things are genetics, right? I mean, if you have a weak tendon or ligaments, or if you have a joint that's just maybe not quite developed properly as, growing up, maybe you did things and it didn't develop the way it should. There are things that you can't really control, but for the most part, I think a lot of our deficiencies in our body nutritionally can cause calcification, or can cause the lack of lubrication in the areas in which we need, especially in our joints. So, an overuse too, right? Because you exercise. Over exercising also can cause the fall of the joint.
Right. It used to be we really discouraged running, but there's actually a recent article that said running, as long as you're not overdoing, can actually be protective. And I do have some patients with pretty significant joints that continue to run, and it amazes me how they continue to go and they do well. So yes, I don't at least discourage running. I like, nice slow jog. I don't discourage it as much as I used to.
So it doesn't do anything about the, well, if you have arthritis, that's different, but it doesn't cause any type of wear and tear of repetitive movement?
Yeah, they've tried to show that, and, they've had studies that have shown a correlation, but there's, when you take out some of the biases that are in the studies, if you're a nice, if you're taking care of your joints and you're not, pushing it too much, actually the running can be a little on the protective side.
So are some of your patients like Ironman athletes or, these triathletes? What are their conditions like? I've always been curious because I felt like these guys would be run down.
No, they actually are, they tend to be people that nutritionally really take care of their bodies, and that's how they're able to do what they do. And the ones that are, if you do strain like your Achilles tendon or your heel tendon, or you do injure something, if they don't push through that, that's when they get in trouble. It's when they injure something and they got a big race and they just push through it, they can cause more damage. But for the most part, their joints are, are surprisingly good.
Wow, I'm surprised because they're doing like at least 5 to 6 hours of training a day when it comes to like if there's like races that year, they have got, they got to run a certain amount, they got to bike a certain amount, and then they swim a certain amount. Yeah. I would think that over repetition would start wearing and tearing down the joint itself. Maybe not so much, the muscle gets used up too, but how much food do they need to consume then in order for them to keep that nutritional component for that joint? Because that seems to be a lot.
They're eating the right foods, and it depends on, their weight. There's a lot of different things that go into how many calories you need, but, they're eating the right foods. I think that's the real key, is to eat healthy, stay away from the processed foods, stay away from the simple sugars. Even bananas, pineapple, mangoes, those have sugar and a lot of sugar in them.
Carrots.
So,
corn.
People think, I'm having my mango, that's fine. But there's, anything you pick up, I always tell people, turn it over, look at the carbohydrates. If it's over 14, per serving, you probably should put it back. So
Probably.
you just, watch those things. But like apples have more fiber in them and they're not as sweet,
Right.
and berries are okay.
Mm-hmm.
But you got to be a little careful with things. But you do need some carbohydrates. You just, you'd want them more complex and not the simple sugars.
And I know that the registered dietitians always talk about eating a rainbow of your whole foods, like, make sure that there's color in your diet so that you know that you're getting different types of vitamins and such from your vegetables. And, you really want to make sure you got your oranges and your red yellows and your reds and your greens and things like that. And I know that vitamin C plays a big role in keeping the joints healthy because of the antioxidant factor. Is there any other vitamins that would be imperative to keeping joint health?
No, I think, people go overboard with all the supplements and vitamins. Just take a regular vitamin, a once-a-day vitamin, and you add your turmeric in and eat healthy.
Yeah. You guys can't get any more simple. Every show, it seems like every doctor I talk to is becoming like an echo. Eat good whole foods and look at your labels for goodness sakes. So as far as your practice goes and your experience with the joint health of the knee, I know that it's can be complicated, but what group of people are you servicing? Did you finding you're servicing the most, and why? Is it women? Is it men? Is it kids? What's going on?
No, it's even women and men. And there's a strong association between weight and knee arthritis, but not that strong association with hip arthritis. So my hip patients tend to be quite thin for the most part, although I have heavy ones. Sometimes they're born with dysplasia, meaning their socket doesn't completely cover the ball, and so they get more edge wear and loading. A lot of times I have former athletes that have football injuries or, skiing injuries or other injuries, and they damage a joint, and then later that they develop arthritis. I have young people at Shriners. I did a total hip on an 11-year-old the other day. I just got an 18-year-old from Guam that needs new hips, and they oftentimes have injuries or deformities from underlying problems that sometimes they're born with. So it's all different, and I don't think there's any one person that I see more than another. I would say my knee replacement patients are heavier than my hip replacement patients overall, but very equal on women and men. It's hard to get the men to come in. They tend to be a little more stubborn and procrastinate, although the women can as well. But boy, I'll tell you, the relief when they are able to get around again, it's pretty profound. So
do you replace it with titanium, or is it a different type of material?
The components I use are oxynium for the weight-bearing part, and then titanium, like on the tibia, and then you got a high-grade polyethylene plastic that fits into the tibial tray. Wow. Titanium is a soft metal. You can't use it as a weight-bearing articulating surface. And in the hips, I use oxynium on highly cross-linked polyethylene with titanium cup and titanium stem, so the bone grows into the titanium stem and cup. And there's no cobalt chrome. We've had some issues with allergies with that. So what I use doesn't have any allergy potential that we're aware of or have had any issues with. So, and the surfaces are amazing. They really are very resistant to wear. And my patients, I have them follow up every couple of years to get x-rays, and I'm not seeing any wear with these newer components.
So it lasts a long time.
Yeah, I think they just looked at all my kids I've done over the 25 years at Shriners, and they're all in and still doing well. So these are, 16-year-olds, 18-year-olds, and they're still in. So the longevity is Yeah, the longevity is good. It used to be we told people, oh, you're too young, just wait until you're 65. But the problem is if you're 50 or if you're 48 and you can't get around and you can't work and you're depressed because you're in all this pain and then you end up on narcotics, what kind of life is that?
Right. No, it's
You
not.
know, so these younger people have to be done. They have to take care of their joints. If you're 300 pounds, that's not, you can't, that's going to cause excessive wear on the joint. So, you need to keep your weight down under control. You need to not be out pounding on it and running on it.
Right.
But the longevity is excellent. So that's been a major improvement.
And it's all because of the materials you're using too, isn't it? That's the technology
Correct.
that I was talking about too. I mean, maybe that's been around for a while, but I'm ignorant to what's out there. I just remember that long time ago, I had a slight bulging disc, and I had a neurosurgeon tell me that he could replace it with this new technology where there's flexibility in the spine. All he has to do is screw it onto the top and to the bottom, and then you can still move your neck like you would normally move it, like it just mimics the vertebrae naturally. But the I forgot what it was called, but it looked like it was plastic. And they just scrape the disc out and replace it with the new disc, and you're good to go for 20 years. So I was like, wow, that's crazy. And they came up with an epoxy. He did, Dr. Landon over in UCLA. He came out with an epoxy glue-like thing, I guess. And he said basically you put it on the fractured bone, and it dries stronger than the bone itself. And so a lot of football players that he was treating, like he's an athlete, doctors too. So he would treat these athletes, and they were as good as new, if not better, with this new epoxy type seal for the cracked bone. I thought that was amazing. But yeah, this sounds really incredible to have surgery and then be able to not have to have another replacement in 10 years. You're able to go on for 2 decades and still be good.
Oh, yeah. I think these newer joints will last much longer than 20. Well, they're already showing to be lasting longer than 20 years. So even with the older designs and the older materials, which had more wear, I have people that are 26 years out and they're still going strong, and their x-rays look good and their motion is good. So, there are always potential complications, but I think for the most part, the longevity is much improved. And then with the partials, we're doing those robotically,
Right.
and you get the alignment precise with the robot, and then you don't get the edge loading, and that markedly increases if you're candidate for a partial replacement in your knee, that increases the longevity. It's like trying to align your tires without a computer. I mean, it's pretty difficult to do. So partial replacements work well, but the longevity is much better if you do them robotically.
So I've been avoiding it. I'm one of those people because I have my right knee has I guess partial meniscus issue. It's called chondromalacia, right? Is that correct? Is that
Chondromalacia is the same thing as arthritis. Yeah.
So
another fancy name for arthritis, loss of articular cartilage.
So yes, I was diagnosed with this at 26 or 25 because I was squatting like 300 pounds and really stupid. But with my lordosis back and everything else, I should have been very careful. But, at some point, I know that I will need to take care of that because I've been working on my muscles, but still, you can't work out the joint. You can't fix the joint.
So much.
Yeah.
Yeah, you get to a point where it's like, okay, enough already. They did a big study in Sweden. They looked at like 50,000 people, and they looked at the ones that lived with the pain because, it's not going to, quote, kill you directly, and then those that had hip or knee replacement, and they matched them for age and sex and comorbidities like high blood pressure and diabetes. And the people that had surgery lived 4 years longer, but with a much better quality of life. They maintained their independence. So everyone's like, well, I don't want to have, surgery, but yet, you get into your 90s and you can't walk. What are you going to do? I had a lady in today. She's 90 and she lives alone, and her knee is at a point where the femur's just shifting over on the upper
Ooh.
leg bone is shifting on the lower leg bone, and she's
Oh.
going to fall and break something, but
Oh.
she's at a point she's going to have to go into a wheelchair. She should have had her knee replaced 10 years ago and could have enjoyed it for the last 10 years, but
Oh.
we're going to get her fixed in a couple of weeks. So,
Oh, that's fantastic. You're like a godsend, I swear. I know there's a lot of people don't realize that and I was one of them, because back then, I'm aging myself, but back then, the knowledge that the layman had was very little compared to what we
Correct.
have now as far as what surgeries can do. And the technology of the surgeries are so much more efficient that it's like a almost 1 hour surgery. I'm just making this
yeah,
up.
it's less than an hour
See?
in my
See?
hands.
I'm telling you, it's crazy. You go in, you go out, you're rehabbing for the next, several weeks and resting it and doing what you're supposed to do, and you're good to go. You're like brand new. It's amazing to me how incredible you doctors are and what you're doing.
Well, it's the doctors and the patients. I tell the it's a team effort. I can do a beautiful surgery, but if I don't have a good patient that's going to work hard and a therapist, and then you're not going to get the results you would have gotten otherwise. And excellent nurses, and it's a whole team effort. So
do you do all your surgeries in the in your location at Windward Orthopedics Group, or do you have a hospital you go to do these surgeries, or where do you?
Yeah, all the surgeries are done at Castle. We have a joint center. Actually, we have the first joint center in Hawaii, and that we started 20 plus years ago. Anyway, there's a whole team of nurses that do nothing but hip and knee replacement, and we have a nurse coordinator, and it's just phenomenal. I tell patients, yep, there's good surgeons in Honolulu and out, in Pearl City and that, but Castle rocks.
Yeah.
It's awesome. It's just, and I go to Maui and do clinic over on Maui, and they're like, oh, come here and operate. I'm like, I got a great team I've been working with for 26 years.
Yeah.
I think I don't want to recreate the wheels. It's just nice. So I do make them come over for their surgery here.
Yeah, I hear a lot of great things about Castle Medical Center. We just interviewed Adventist Healthcare Group, and they seem to be all about holistic wellness. It seems to be a good group of people with a good understanding of what health should be for their patients, and that's good.
Yeah, I think they all care. It all comes from the heart, and boy, you can tell that.
Yeah, and that's what it is, right? You want to go somewhere where people are going to sincerely want you to be well, not just take your money and say, okay, we'll come back again, and then let's take your money and then come back again. There's no result. It seems to be more result oriented, which is really nice.
Yeah, there's not really much money in medicine anymore. I think the people that are in it for the money, they're not here in Hawaii.
No, it's not. It's not. It's not. And
That's right.
It seems to be that you guys are needed more and more now, especially with everything that's been going on. People are so dependent on, our health professionals that, it's really, truly, I always tell people doctors are amazing because you guys give so much and you have to do so much for the red tape that comes along with insurance and things like that. You have to fill out all this paperwork to take care of one patient for 15, 20 minutes. You get to see him in the office, and the rest of the time you're filling out paperwork. It's really a lot of stress, but you do a great job. And I know that you particularly are well respected. And after seeing your bio and all the things that you've done in your career, really, really amazing. You're an amazing doctor. And I'm so thrilled to have met you because now I have my connection to someone who's a professional and specialist in the hip and knees. Because let me tell you, I've done some damage. And I probably will need to see you soon for sure. How can our folks get a hold of you if they need to set up an appointment, at least get a consultation from you?
Just call the office, 808-261-4658. And our office is really good. There's a few insurances where you need your primary care doctor to refer you, like Quest is the biggest one, but Medicare, most of the HMSA plans, you don't need a referral, so you can just come directly. And then, if you're coming in for a hand injury, we're probably going to have you see Dr. Ganesh. Or if you're coming in for an ankle injury, you'll probably see Dr. Black. Or Dr. Medoff is also in our office that does hand. But, the office is very good at getting you to the appropriate person to help you out.
Do you guys have rehab
We
there
do
as
have
well?
a website. Huh?
You guys have rehab there as well?
No.
Okay.
We do not, which is a good thing. I think when the rehab's in the doctor's office, there's financial incentives from that, and I really think it's nice. We have therapists that we work with, but we don't make any money off of sending you to rehab, and I think that's the way it needs to be. We do like platelet-rich plasma. We do those injections, but we don't charge you like they do elsewhere because we don't want to make. That's not something insurance covers, but not something we're there to make money off of. So we really just try to give you the best experience possible, and we're definitely not in it for the money.
But you said you had a website, and your website is what?
Windortho.com.
Well, that's easy. Windortho.com. Okay. And then they can contact you through there too. I mean, I'm sure there's a contact page.
Yes, you can email and someone will call you back. Just call on the main number though. And the other nice thing is someone answers the phone.
Oh, wow. What a concept.
Get this, punch 2 for billing and do this for that. Someone always answers the phone except from 12 to 1 when everyone's at lunch. But someone answers the phone, and if you leave a message, they're pretty darn good about getting back to you.
Isn't that funny? It's like old school, right? Yeah. But I can't believe we have to say that it's an old school technique because everybody's gotten so digital. It's crazy. Oh my goodness. I want to hang up when I get all the different options, and then you sit on hold forever. I know. Well, you get caught up with your music. That's the most important thing, right?
Right.
I know, it's crazy.
We don't have the best music, but anyway, it is a very good experience for the most part.
Well, I truly appreciate you. Like I said, I'm thrilled that I got a chance to interview you, and I'm also excited for the audience because now they know they can reach out to you and they have a contact when it comes to knee and hip replacements. This is fantastic. Thank you so much, Dr. Linda Rasmussen over at the Windward Group. Please contact her if you guys need anything from her regarding your joints. I appreciate you, doctor. Thank you for taking your time with me.
Thank you.
All right. You have a wonderful day. And my group audience, I just want to say thank you so much again for taking the time out to listen to the show. And if you guys have any questions for me, if you need to contact me to reach out to Dr. Rasmussen, or if you want to talk to me about your training or your health and your nutrition, because that's all we ever talk about on the show, reach out to me on my website, befitforhealth.com. Go to the contact page, and there you can email me, and I'll respond to you within 24 hours. And also, if you guys missed any of the shows, I do have a YouTube. It's Be Fit for Health. Or you can go on my website, and my website also has the podcast. You can review the shows that I had in the past year. If you need to get someone's information, it's on there. Definitely, these shows are here for you. So you can definitely access some of the past shows on there for your well benefit and your family's benefit if you need it. Other than that, this is the end of the day for us here. And I want to thank you for your time. And please take care of yourselves. We are, looking to have a healthy new 2021. So do what you can, eat well, sleep well, be good to each other, love well, laugh a little bit. And that's all I can ask for. All right. Have a good day, guys. Thank you. Aloha.